Okay, everyone. I'm going to go ahead and start with just a short registration process so that everybody is familiar with it in case you are a new employee or have not registered on the portal yet. You would go to the mypathwaytohealth.com. On this main page, you would click onto the Start Registration Process. You do put in your Social Security number twice. If you are the spouse, you would put the Social Security number and then your own Social Security number, so it would be two different ones, and then your date of birth. On the next page, you create your own unique username and password. A confirmation email is sent to you. Once you confirm that registration, you never have to do this part again. You simply just log on with that unique username and password that you created. So let me go ahead and get logged in here. The first thing you're going to see when you log in is something that's called an action list. This is going to allow you to see the three main components that you need to do in order to qualify for the incentive, and then your status accordingly. The green check mark means that this has been done, and the red X means that you still need to complete this. Even once all of these items are done, this will still come up and you will see those check marks. So that ensures you that you have done everything that you need to do in order to qualify for the incentive. If you have any questions about any of this or any portal questions, the number for our support staff is right here on the bottom and they would be happy to help you. One of the things that you need to do in order to qualify for the program is to go ahead and take a health risk assessment. The health risk assessment is very easy to complete. It's only 30 questions and takes about 8 to 10 minutes to complete. Once you do complete it, you do get a confirmation email sent to the email address that you provide so that you can keep that for your records as well as seeing that on the action list that it has been completed. Your bank will have an on-site screening event. You can have your screening done there, or you can also go either to a LabCorp or to your physician to have that done. Once we have your screening results, we're going to import them into the system, and then you do receive an email letting you know that they've been posted onto the portal and you can view them. You would come to My Screening Results. It will show you the different dates that you've had screening results imported into the system. You find the one that you want to view, and you click onto your data. It's going to show you all of the tests that were done, and then your associated value. We all kind of hear all of these different terms thrown around, LDL, HDL, but we really might have the clinical knowledge to know what that's measuring within our blood. By clicking onto View Description, it's going to take us into the HealthWise library. It's going to give us information as to what those tests are measuring. It will give us national standards so we can kind of see where we fell before we either speak with our health coach or share these with our doctor. Now, once we have the biometric screening results and the HRA is done, what's going to be created is a personal health profile. This is a very comprehensive 27-page report, and it's completely unique to each individual person. It is all of their answers off of the health risk assessment, and then all of their values off the biometric screening. Where you have risks, they're going to be identified. It's going to let you know what's triggering those risks and give you ideas on how to start making changes. Even if you fall within a healthy category, it's still going to give you recommendations on how to maintain that good health. All of your values are very easily seen for you. It's going to show you what yours was, where that puts you in a risk if you do have a risk, and then it lets you know where those ranges so you can easily see where you fell in. Something else that this personal health profile will provide you is where you do have risks, if changes aren't made, what this risk is going to do for your health long term. This does come up in a PDF, so it's very easy to print off if this is something that you would like to share with your doctor as well. And then it's always kept in your portal to go back for easy access. Let me show you the main dashboard page. Just like the personal health profile, this main page is completely personalized to you. It is all of your health information and then all of the main activity that you're engaged in on the portal. The first thing you're going to see is your health focuses. These are the conditions that were identified through the health risk assessment and biometric screening. This is a rolling screen. So if more than 4 conditions were identified, each time you come back to this main screen, it's going to change slightly so you can see all of these different focuses. Any of these you can click onto, and what it will do is provide you links back into the HealthWise library. This way you're able to obtain more information on those particular risks. You can see what is triggering them, any kind of testing or medication that might be recommended for that particular area, but more importantly, it's going to give you a source of knowledge to understand that particular risk, and then ways to start lowering it, to start making you more healthy within your conditions. The next thing you're going to see is your risk score. This is a combination of the health risk assessment and biometric screening. Your score can be anywhere from a -2 for your most healthy, all the way up to a 40 to your least healthy. You'll see your numeric value and where that puts you, whether it be at a healthy, low, emerging, high, or chronic risk. By clicking on to find out, you're going to be able to see all of the different factors that were used in order to generate that risk score. You can see exactly where your risks are and why you fell in between that risks. So you can easily see that because my BMI is in between these numbers or my fasting blood sugar is, this is why I've been identified with that particular risk. The next thing you're going to be able to click onto is the risk score classifications. This way you can see exactly how the risk scores are ranged out, and you can see where you fell. That way you can really gauge, are you closer to the one below you or above you? What you'll also be able to see then is your current risk score next to all of your previous. If you've been with us for a couple of years, you're going to see a number of these risk scores for you. That way you can easily see, are you making strides to improve your health? Are you staying kind of flat and stagnant? Or in some cases, are you actually getting a little bit worse and need to work a little bit harder on your health? What you'll also be able to see then is your risk score next to your peer group. Now this is the entire IBA trust. This is not SHS's whole book of service, but it is your fellow employees within the trust. That way you can easily see where your health is compared to your other peers. And then down here, it's going to show you exactly what your peer group is. The next thing you're going to see is the top 3 trackers you are actively engaged in on the portal. There's more than 14, but your top 3 of most access is here for you to easily be able to update. These trackers you can click onto. You can hit Add Entry. You don't need to type in the date. You simply choose it from the calendar. In this case, I worked out for 35 minutes and I ran. I hit Add Entry. It is now in my trackers. You can also go ahead and do this not only from your desktop or laptop, but you can also do this from your mobile device. That way, when you're at the gym, you can go ahead and log your exercise or even update your food journal at a restaurant. But better yet, we are integrated with many of the different fitness devices. You would be able to simply wear those devices, and then the information that it is collecting will automatically be sent to your portal. To go ahead and link up to one of these devices, you would go to the tab that says My Fitness Applications, and it's going to provide you with a link to our marketplace. In this marketplace, you're going to see the top 15 to 17 most commercially used devices. We can integrate with up to 170 different ones, but the top ones are here for the members to easily be able to do. To connect to a device, you simply go ahead and find it within the marketplace. I have a Fitbit, so I'm going to go ahead and connect with that. You go ahead and use the login for that particular device that you have. You go ahead and log in. You can choose what information you would like to be sent over to your trackers. You can choose as little or as much as you would like. You hit allow. You are now synced. As long as you are syncing that device, you never have to go back here and reconnect unless there's a problem with your particular device syncing. all of that information that that device is going to be collecting will automatically be going ahead and sending that information to those associated trackers. You can also go ahead and connect with more than one device. If perhaps you do wear a Fitbit, but you also use MapMyFitness, you can connect to both. I just do want to point out, though, that you will not get duplicate points on your scorecard for using more than one device. So what I'm trying to say is if you will not get like 2 points for exercise if you're mapping MyFitness and using Fitbit. You'll only get 1 point. But when it comes to a device like Fitbit that takes track of your steps, your calories burned, exercise, those are 3 unique trackers that you would get credits for. Also to point out, for IBA, they do require that you walk 10,000 steps in order to earn a point and burn 250 calories. So you do need to meet those qualifications for a day in order to receive a point. When it comes to the other trackers, exercise, your heart rate, any of those trackers that you may be using, there are no minimums for any of those. The next thing you're going to see on that main dashboard page is MAP, and that stands for My Action Plan. It's the goal setting tool that we have for you. It's based on the intrinsic methodology of really having you take the time and think of that goal that is important to you. We really feel by you wanting to establish that goal, it's going to make you that much more likely to achieve it. It's going to ask you 4 questions, and the reason why it does that is it wants to make you more aware of why you want to achieve that goal. Not only is it going to make you more aware, but your coach is also able to see that. This way you can work collectively to establish a plan that's going to work best for you. Once that plan is established, you'll be given a to-do list, different things to start working on to achieve that goal. And once you go ahead and do it, you're going to want to go ahead and check mark that. And then it will also give you the best tracker to use to help you with that goal. As you're entering in this tracker, you're going to see your progress bar goes up. This is really to help you stay motivated and to know that the different things that you are doing is helping you to ultimately achieve your goal. Finally, the last thing that you're going to see on this main dashboard page is the correspondence back and forth with your coaches. If you see the little blurb light up green, that means you have not viewed it yet. Once it's gray, that means that this is a message that you already have viewed. When a message comes in, you simply click onto it, you'll be able to see it, and then reply directly from there. There are 2 different messages that you can send in to your health coach. You can send in a health update, and you will receive points for this as well. This would be kind of like, I went to my doctor, my blood pressure was 140/38, and he decided to change my hypertension medication, and here's my new medication. That way your coach is kept informed of any kind of health changes that may be happening, but then it's also kept in your history for all time. You can also compose new messages. Perhaps you need a little motivation, you're stuck, you have a challenge that you can't quite get through, or even maybe you have some questions about the program or how to go through the portal. You would choose a subject matter either for your health coach or for a support person. Type your message into the body and hit send. All of our messages go over in real time. As soon as you hit send, it's going to go over to your assigned coach's inbox, or if it's for an administrative person, to their inbox. The messaging is also available on the smartphone app. That way you can go ahead and send and receive messages from your coach directly from your mobile device. Let me go through some of the other areas that we have over on the side here for you. Something that we're very excited to offer you this year is the sedentary interruption built right within the portal, and that is the UtiliFit games. Each day you will be able to go in here and go ahead and set up a game to be pushed out at you. The games are set up according to your physical level. So if you're not very physically endurant, you can go ahead and have a light workout, which would be as easy as drinking an 8 glass of water or just walking around for 35 seconds. If you're a little bit more physically fit, it can be anywhere from doing lunges to burpees. So once you go through here and you can go ahead and see all the different exercises that would pertain to you, you can pick one and then you would click onto it. You do have the ability to go ahead and have either a challenge sent to you every hour or every 4 hours. This is allowing you to be able to fit it into your schedule. So then if it's an hour, you have an hour to complete that, or if it's every 2 hours, you have a 2-hour span to complete whatever activity is pushed out to you. You also have the ability to decide when to start the game. Perhaps you have an early meeting morning and you can't get to it right away. You want to start it after lunch. You'll be able to either start now or then pick the time that you want to start it at. Once you pick that, you hit start. You're going to be all set. Those pushes will go out to you and you'll be able to go ahead and have that game to you. It's a lot of fun. It gets you moving because a lot of times we get really set just right in front of whatever we're doing with our tasks and don't move around throughout the day. As I had said, we have more than 14 trackers available onto the portal. Those top 3 of most activity is different for each person, only on that main dashboard page. But to view all of the trackers available, you could click onto this link right here. It will give you a definition of what each of those trackers are keeping track of, and then the recommendations on how to use them. Once you do add an entry in there, it'll be on this main page for you. And then you're also going to see the trackers that your device is automatically uploading for you. So all of those are right here for you. We do have a food journal right within the portal in case your device doesn't do that for you. It's based on the USDA and it will allow you to keep track of the calories, fat, carbs, and proteins that you are eating throughout the day. You can go ahead and type in a food that you would eat and go ahead and search through it in the database. It's going to give you all of the foods that pertain to it. So once you've found the item that you consumed, you can go ahead and hit I ate this and it will be added to your food journal. Now we all kind of have those top 20 things that we eat frequently throughout the day. Instead of having to go each and every time to search through that in the database, we can go ahead and click onto this star. By starring it, we're adding it to our favorites. So in a sense, kind of creating our own little menu. This makes it much easier then to go ahead and update onto the food journal because you can come to your favorites and directly add that in there. We do provide health calculators for you. We all kind of hear different terms thrown around, metabolic rate. A lot of times, we know smoking is bad, but we really don't associate what that cost is to us. One of the ones I particularly like is the smoking, because not only do we know it's bad for our health, but a lot of times you don't take into consideration the monetary impact it's having on you. So let's say I am smoking 25 cigarettes a day and I'm paying $5.75. I can calculate that out and it's going to show me what I'm spending per week, per month, and per year. A lot of times this right here is enough of an eye-opener to really think about, wow, not only am I hurting myself physically, but boy, I could really take a good vacation with this $2,600. So again, it's just another way of thinking and learning a little bit more information on some of the goals that you may have. We do keep a history of the consents that you do sign at the beginning of each year. It is here for you, and you're able to reread that. We do know that some of you might have a little bit issues with the consent. You can send in a revoke of consent so that your information is not shared aggregately. We never share personal information, but we do provide an aggregate group summary to Capstone. But if you don't want your information included in that, you can always go ahead and revoke that, and then that date would be right here for you. On my account, you're able to go ahead and change your username, passwords, and email addresses. One thing that you can't change in here is your phone number or your addresses. We do ask that you go to your HR at your bank, so it's changed officially with them. That will be sent to the eligibility file, and once we receive that new eligibility file, then it's going to be automatically updated into the system. We just want to make sure that we're very cohesive with what your bank has compared to what's being shown in our system. we have a decisions dashboard. This allows you to search for any kind of medical information that you may want to view a little bit more about. We know that Google is a wonderful search engine, but there's a lot of uncreditable health information out there. This is URAC accredited, so you know the information you get is good medical information. And then we also have an interactive symptom checker. This would be for those day-to-day health situations that come up. You can check whether you're not looking for a man, child, or woman. Let's say our child woke up in the middle of the night and they have abdominal pain. What it's going to do is going to ask you a series of questions. At the end of these questions, it's going to let you know that this is something you need to go to the emergency room for immediately, that this is something you should call your doctor for, or if it's not emergency related, it's going to give you ways to go ahead and treat that at home. Now, the site strongly stresses that this by no way would ever take place of an emergency room or your doctor, but it really does have shown to give you really good information to make educated decisions on something that's emergency related, or if it's not, ways to treat at home and save you on those very expensive emergency room visits. The activity scorecard is where you're going to be able to view all of the points that you have earned for your incentive. By scrolling down at the bottom here, you're going to be able to see what your total is, and you'll want to earn at least 115 to qualify for your incentive. One thing I do want to bring up, in order to see points for your blood results, for your lab screening, and for the HRA, both of those must be completed. If you have done one or the other, but not both, you will not see credits onto your scorecard until both of them are completed. Any of these activities you can click onto. It's going to tell you how to earn the credit for that activity, what your point increments can be. So in this case, the trackers, you could earn 1 point per tracker, and there is no max on those. This is just your program date information. And then down here, you're going to be able to see the date and the credit that you've received for each one of those activities. That way, it really allows you to keep up and make sure that all of those points are onto your system. You can go ahead and view health grades directly from your portal. So if you need to go ahead and search for a doctor or a specialist, or perhaps you're out of town and need a doctor in that location, instead of once again going out to Google, you can come right here to your portal and be able to view all of those. And then each month we do put out a newsletter. The monthly newsletter is going to talk about the healthy monthly observances, kind of tips around the holidays, always gives you healthy recipes. All of these are kept here archived, so at any time you can go back and view any of the particular articles that you may have found interesting, or go ahead and get a recipe back out that you might have forgotten to write down. Something else I also do want to bring out, when you put your cursor over the My Pathway to Health dashboard, a tab comes up for My Reference Documents. By clicking onto that, it is going to provide you the resources of all of the different information for the program. It's going to allow you to be able to see the program guide. Again, the program guide will give you the same information that I just did of all the different activities. If you're a new hire, your new hire information is in there. And then also the new ACA notice is also listed for you to be able to view. So those are all the main tools and resources that are available on the portal. Does anybody have any questions?
Any questions? No, I don't think so.